The statistics are staggering. Study after study shows that the health of minority men, women, and children in this country, particularly those living in poverty, is dramatically worse than the health of the population at large. The disparities mean higher incidences of disease.
Among blacks, the prevalence of obesity is 51% higher than it is among non-Hispanic whites.
African Americans have the highest morbidity and mortality as a result of being overweight and obese.
African Americans with heart failure are admitted to the hospital far more frequently than their white counterparts.
Hispanic American children have a much higher predisposition to accumulate body fat, which leads to obesity.
Latinos living in the United States are at an increased risk for developing both diabetes and complications related to diabetes.
African American women nowadays are 20 times more likely to be infected with HIV than white women.
The list goes on. But here at the UAB Minority Health and Health Disparities Research Center, we're fighting these statistics by finding the answers to why they exist, thanks to an investment that is cultivating new research, new researchers, and new funding critical to both. It's a three-point investment made possible by your generous support. And it started 6 years ago with a man who's well acquainted with three-pointers.
Up in the air, out to Barkley for three. It's his first three of the year. He was 0 for 8.
In 2004, NBA All-Star and Alabama Sun Charles Barkley set his sights on a new goal: advancing health equality in the Deep South by partnering with the UAB Minority Health and Health Disparities Research Center. To date, this partnership has raised more than $2 million to support UAB's commitment to that goal. The Barkley Health Disparities Research Awards have provided pilot grants to 17 young investigators to seek real solutions to the real-life health challenges of minorities throughout our region.
Kids ages 3 to 6 came over to a local health department, and we delivered a very happy and fun program for them to learn about healthy eating habits, getting more physically active.
Because of the Charles Barkley Award, we've been able to figure out why children of Hispanic immigrants may not be able to find services for their eyes.
What the award allowed us to do was to identify some of the problems that Hispanic families were having and see how we can intervene and help them.
Well, ultimately I want to take over the world, but we want to really actually make a huge dent in the obesity epidemic.
The Barkley Awards have sparked innovative science. They've also launched the research careers of junior investigators hoping to enter the field of health disparities, creating a new generation of researchers seeking to make a difference.
I'm relatively new at UAB, and getting the Barkley Award has really afforded me the opportunity to get started.
It gave me really the ability to start the work that I had proposed to do.
It would absolutely have not been possible for me to do my research project.
I wouldn't be doing the research if it wasn't for the Barkley Award funding.
The Barkley Awards have not only launched careers, they have also enabled these promising young investigators to continue their important, groundbreaking work. With preliminary data to back them up, award recipients have gone on to secure close to $4 million in additional grant support from pivotal funding sources.
Without opportunities like this, I think it's much more difficult to obtain preliminary data that's required to go out and secure additional funding on the outside.
We have enough trends that we're really optimistic that there's something there, and we've already started writing an NIH application.
What I've been able to do with this pilot data is go on and apply for larger, more competitive grants from organizations like the National Institutes of Health and the American Heart Association.
We've gone on now to secure funding from the Robert Wood Johnson Foundation. We've secured money from the National Institutes of Health.
Your investment in disparities research is already helping the brightest young minds translate science into service for those who need it most. This three-point stake in new research, new researchers, and new funding has given us a 3-point lead in the fight against health inequalities.
Just as it has allowed me to improve my clinical practice, I hope that additionally I'll be able to provide other clinicians with this information.
The research outcomes can affect so many people, and that's what gets me so excited about doing research.
Much remains to be done in the fight against health disparities. But thanks to your support, it's a fight we're now poised to win.
I'd like to take this opportunity
to be able to thank Charles Barkley,
the Minority Health and Research Center,
and all the donors who helped to make this fund possible.
For this prestigious award, and particularly the foresight to address minority populations in this day and time.
Hopefully really can make a difference, but it's not possible without people being willing to share resources, so thank you.
Continue to give, continue to support this very important work. It will be a lasting legacy.